Ladies and gentlemen, Brandon Hull and Arnaub Chatterjee.
Good afternoon and welcome to the afternoon apps demo portion of Datapalooza 2012. We're in competition here with Atul Gawande, the most interesting man in healthcare, in another session. Hence the sparse turnout perhaps here, but we think it'll fill out later, and we're expecting an action-packed afternoon. By way of introduction, I'm a venture capitalist with a firm called Cardinal Partners. For 22 years, I've specialized in healthcare information technology, ranging from markets that include payers, providers, be they outpatient or inpatient, patient and clinical decision support technologies, and infrastructure that fills the chinks in between. I've been founding investor in such companies as VisiQ, which was remote monitoring for patients in intensive care units. I was the first round investor in Athena Health, backing Todd Park, Jonathan Bush back in the day. Companies like CodeWrite, which do natural language processing for decision support for coders, recently sold to 3M. And our current portfolio includes companies like Teladoc, LifeImage, WarePoint, Vitals.com, and so forth. So I'm excited about the panel of companies we have to talk about this afternoon. Welcome your questions, and we'll add some of our own. Arnaub.
Thanks so much, Brandon. My name is Arnaub Chatterjee. I work as special assistant to the Chief Technology Officer at Health and Human Services, and for the overlord of all things health data, Todd Park. So I've had the luxury of sitting at the intersection of health and technology for the last 2 years at HHS, and it's been a really cool ride. I mean, in 24 months, just the sheer expansion of the ecosystem has been really amazing, and just the pop-ups of codathons and hackathons, and the number of people who have gone from untraditional health backgrounds. I mean, people who worked in the manufacturing sectors, electronics, who are now popping up in healthcare and tackling a problem that is really difficult is awesome and really inspiring and makes our job really interesting. I had the pleasure of helping to review some 250 different apps and services that we reviewed, and it was just amazing to see the sheer amount of talent. And with the best of show here right now that's presenting, I think it's going to be a really good treat. I think you guys are the nice, awesome, intrepid souls for being here, and we are assuming we have millions of people watching online right now. So it's going to be a great show. I'm really pumped to do this, and with that, I'll let Brandon make the first introduction.
Thanks. And by way of format, probably this is in the schedule, but each presenter is allocated 15 minutes total. The expectation is that'll be 10 minutes of pithy expostulation, followed by 5 minutes of questions. So the burden is on you for that last 5 minutes. Our first company this afternoon is Eliza. I'd like to introduce Alexandra Drain. She has the auspicious title of Chief Visionary Officer. As a longtime investor in healthcare, there was a whole season there in the late 80s, early 90s where disease management companies were sort of finding their way into the vernacular. Insurance companies were worried about, kind of managing different high-risk populations. The industry sort of started with behavioral health and migrated to other levels of acuity, but finally sort of evolved to a general standard of population-based disease management. And I, like many of my peers, invested in a few of those companies. And I'm here to tell you that one of the primary challenges in the early 90s of doing population-based disease management was just the sheer logistics of being able to interact with your installed base, with your customer base. The sheer logistical burden of reminding people to pick up hemoglobin A1C test kits or fill their prescriptions. All these issues of compliance and adherence were extremely labor intensive. Time marches on, and I think what we're going to hear about today is a way that technology has begun to automate those and some other problems. So with that,